the HSE expects to recruit only half the extra staff it is funding for this year due to recruitment difficulties. However, the HSE service plan for this year, published yesterday, commits to the delivery of 5,500 whole-time equivalent staff at a minimum. The HSE's CEO, Paul Reid, joins us now. Paul, why is it so difficult to recruit staff nowadays?
Good morning, Shane.
Morning.
And Shane, just very briefly, just with all the distressing news coming from Ukraine, I just want to send a special message out to all our Ukrainian workforce that we have in the health service, and just an understanding of the tremendous stress and duress that they're going through at the minute for their families.
Yeah,
acknowledge that.
Well said, Paul.
Yeah, very briefly, just in terms of the recruitment process, we have, as you just outlined, funding to recruit a net increase of another 10,000 staff in the health service overall. Now, just to stand still, we every year have to recruit 9,500 people to stay still. So what we are saying is, on top of that 9,500, we've a funding for another net 10,000 as well. It's a very challenging healthcare market out there at the moment. We know from the past 2 years, we recruit 35,000 staff, offer 35,000 staff new contracts, and that was a net increase of 12,500. So it's a very competitive market. What we are saying in our service plan, we're doing everything we can possibly with new models of recruitment to recruit, but there's a global, worldwide demand for healthcare workers across all skills and professions, and that's the market that we're operating in. But very positively, off to a good start. December of 2021, 1,000 people net extra in the health service, and in January a further 675. So, we are very focused on this, but we're just reflecting it is a challenging market.
Is it particularly hard to get staff to go for regional hospitals? I'm thinking of, say, consultants for regional hospitals. Is that a particular challenge? Yeah,
if we were to focus in the specific challenges themselves, it is in the, let's say, the less urban centres, so some of the more rural centres around the country, in the northeast, in the northwest of the country, up in some parts of Donegal, in the southwest, and some parts of Kerry, trying to identify and get agreed contracts for particularly specialist consultants in some of the areas, because it's not that they're not great places to live, which they are, but a lot of consultants and specialists want to operate in the bigger urban centres, and that's a challenge, not just a challenge in Ireland here, but it is a challenge in some of the other countries too. But that's probably where our acute focus is in terms of some of the more challenging recruitment aspects. But very positively, as I said, last year we have to reflect, if you take since January 2020, 12,500 extra workforce, and on consultants in particular, which is a really challenging one. We've had 360 net increase in consultants in the past 2 years. That's the biggest increase in many years, probably since the health service HSE was established, So it is a challenging market. We're making progress, but we are reflecting the reality of the environment we're in.